Students claiming disability help for their HSC exams has almost doubled in New South Wales over the past decade. According to the Sydney Morning Herald, more than 10,000 applications were granted last year. Principals are blaming a rise in ADHD, anxiety and other mental health conditions for the increase. Well, joining me live is Professor Ian Hickie, psychiatrist, author and co-director of the Brain and Mind Centre. Thanks so much for joining us. Yeah, so the report does talk about the cases have almost doubled in the past 10 years. Would you say that's partly due to increased awareness and support?
Absolutely. I mean, parents are focused on getting better educational outcomes. Schools are more aware. And there has been attention to particularly young boys who are in trouble, who are struggling in class with behavioural problems or cognitive problems. So awareness has gone up to identify educational problems early and then seek an appropriate diagnosis and educational support through schools.
And when we hear the word disability, is that the right definition for people, or would you say some people learn differently?
Disability is not a great expression. It implies it's lifelong and permanent and not much can be done. Really, these are learning difficulties, they're cognitive difficulties. Different kids, particularly boys, actually mature at different rates. There's a good deal of variation. And simply the age you are at a particular class is not a good indication of what your brain is doing at that time. So some are slower to mature, they learn differently, they learn in different environments, but can struggle in just an average class with the expectation that by a certain age, you will develop certain cognitive abilities, including the ability to attend, to actually sit down and be quiet and just learn like everybody else. So there are different learning styles as well as different rates of maturation. And that creates real problems when people are competing in the same age groups against each other for educational outcomes, entry to selective schools, success in the HSC, all those other things that parents and schools really care about.
Yeah, you make some really good points there, and it's quite interesting to see over the years the different ways and the different pathways that you can go to TAFE now and complete your HSC, or you don't even have to get an ATAR. Are you liking the changes that we're seeing?
Yes, I mean, I'm from the university sector and we've been saying to schools for quite a while now, ATAR isn't everything. I wish parents and others would pick up on that. And a lot of kids do not benefit from going to university. They'd be better off doing trade courses or having other life experiences, working in other ways and coming to education later on when they're better suited to progressing in higher education after school. So we have to be really careful about the idea that everyone has to finish year 12 in the same way and then everyone has to go on into higher education beyond schools. A lot of kids do not. A lot of boys in particular do not fit into that model. And then they're more likely to be diagnosed with ADHD or a learning problem or a learning difficulty. And of course, then more likely to be treated. So we have problems of perhaps over-treatment in some domains. Of course, in other areas where people don't have ready access to quality assessment, there's the danger of under-recognition and under-treatment.
I only just heard yesterday somebody saying that they knew of someone who dropped out in year 10 and went through and now has done a science degree and a medical degree. So are you seeing lots of those types of stories?
There are lots of examples, like I said, particularly in young men, and lots of experiences overseas with defence forces and other things where young men went into other occupations from year 10 onwards, from year 12 onwards, and then came back to higher education in their mid-20s, etc., and did really well and had opportunities for a different kind of education at that time. Lots of people have gone into work experience first or travelled or done other things. So the idea, which is a terrible idea and it gets pushed out continuously, you must finish year 12 in the same way, then you must go on to higher education, for many actually just creates more difficulties and premature failures in life's opportunities.
Oh, it's so stressful, isn't it, getting to that year 12 and all of the exams and everything. But what kind of help is available for people that are struggling, and how do students apply for that help?
Well, schools have become more aware of this, and those schools with more resources, I think is what the Sydney Morning Herald's reporting, those schools with more resources tend to put more emphasis on getting independent medical assessment, perhaps diagnosis and treatments, and then educational supports. So in the wealthier parts of the country and in the wealthier schools, you see a lot of activity in this space. What's really struggling is a lot of our public schools and a lot of our outer regional areas where access to healthcare and assessment is very expensive and not easily available, and schools themselves don't have the degree of teacher support or individual student support to respond to the different kinds of learning problems and, as you said, different kinds of learning styles that different kids have.